Have you ever felt your heart beating a little harder at night and wondered why it always seems to happen when the world gets quiet? A patient of mine once told me she felt perfectly fine during the day, but every evening her chest felt heavy, almost as if her heart was carrying a weight she couldn't explain. I want you to imagine this for a moment. You're settling into your favorite chair, the lights are soft, the day is finally slowing down, and yet your heart feels like it's working overtime. Why does this happen, and why does it happen so often to older adults? After more than 30 years of caring for seniors, I can tell you that the heart behaves differently at night. As metabolism slows, blood flow shifts. Hormones like cortisol fall while melatonin rises, and this natural transition can expose underlying strain most people don't feel during the day. And without realizing it, many older adults slip into evening habits that quietly increase pressure on the cardiovascular system. It's not dramatic, and it's not sudden. It's subtle. It builds little by little until the heart begins to whisper its warnings. This is the hidden truth most seniors never consider. Small habits have big consequences. Those late-night snacks you consider harmless, the long hours sitting in the same position, the emotional stress that follows you into the evening, or the tightness and occasional shortness of breath you brush off as normal aging are not random events. They are signals. Every evening choice you make influences inflammation, circulation, blood pressure, and heart rhythm. And while that may sound concerning, there is good news. Awareness is the first step toward healing. This topic matters deeply because heart disease is still the #1 threat to older adults in the United States. Studies show that up to 60% of nighttime cardiac discomfort is linked not to disease alone, but to lifestyle patterns that can be changed. In this video, you'll learn the biggest nighttime mistakes that hurt your heart, the risky evening habits that overload your system, the gentle routines that protect your heart, and the simple science that explains why nighttime stress affects you more than you think. I always tell my patients that the heart whispers before it screams. Tonight, I want to share those whispers with you so you can protect your heart long before trouble begins. Stay with me, and if you find these insights helpful, I invite you to subscribe to Senior Health Daily so we can continue this journey together. Your heart deserves it. Food-related evening habits. Let's begin with the part of the evening that most people find comforting: food. I often tell my patients that the evening meal sets the tone for how your heart behaves the rest of the night. What we eat, how much we eat, and when we eat can quietly shape the rhythm and workload of the heart long after we fall asleep. And the truth is, most seniors don't realize how closely connected their dinner habits are to those moments of nighttime pressure, palpitations, or restlessness. Imagine finishing a large, heavy meal late in the evening. You might feel full and content, but inside, your digestive system has just begun its hardest work of the day. Digestion demands more blood flow. As blood rushes toward the stomach, the heart must beat a little faster and push a little harder to compensate. For younger people, the body handles this shift with ease, but for older adults with naturally slower metabolism and less flexibility in the blood vessels, this small change can feel like significant stress. Many seniors tell me that lying down after a big meal triggers a sense of tightness in the chest or a fluttering heartbeat. What they don't know is that reflux and increased abdominal pressure are quietly sending the heart into a more reactive state. The body is simply trying to keep up. Salty dinners and processed foods add another layer of evening stress. As the kidneys age, their ability to handle excess sodium naturally declines. When someone over 60 eats a salty meal, especially late in the day, the body tends to hold on to more fluid overnight. This extra fluid increases the volume of blood the heart must pump, raising blood pressure and making nighttime breathing or circulation feel more strained. I remember one patient who told me her fingers swelled every morning, but she never connected it to the microwave dinners she enjoyed the night before. Once she reduced her evening sodium, her swelling eased, and her nighttime heart pressure dropped dramatically. Then there are sugary snacks and desserts, the sweet comfort many people turn to at the end of a long day. The problem isn't just the sugar itself, it's the sudden jump in glucose. When blood sugar rises quickly, the heart works harder to stabilize it, and in older adults, this can lead to a drop in heart rate variability. Low HRV is a sign that the heart is under more stress than it appears. You may feel relaxed on the outside, but internally, your heart is fighting to keep things steady. Many seniors have told me they wake at night feeling their heart pounding without knowing why. More often than not, it's the late dessert talking. Caffeine and chocolate at night create yet another challenge. Stimulants linger longer in older adults because the liver metabolizes them more slowly. What you drink at 4 p.m. may still be active in your system at 10 p.m., pushing your heart to stay alert when your body wants to wind down. I've heard countless seniors say, "A little coffee never bothered me before." That may have been true at 40, but at 70, the same cup can trigger nighttime palpitations, shallow sleep, or a restless heart. Food is emotional, food is cultural, and food is deeply personal. Yet the heart responds to food in purely physiological ways. When seniors understand how these evening choices affect circulation, digestion, and hormonal balance, the path to better heart health becomes much clearer. The goal isn't to remove joy from eating, but to make choices that support the heart, instead of surprising it with unnecessary stress. As we move into the next segment, I want you to hold on to one idea. Evening habits act like silent messages to the heart, and after decades of work, your heart deserves messages of calm, not confusion. Behavioral habits that stress the heart. Now that we've explored how food quietly shapes your nighttime heart health, let's move into something just as influential, but often overlooked: the everyday behaviors that fill your evenings. These are the habits you don't think twice about, the routines that feel harmless, even comforting. Yet many of them ask your heart to work harder exactly when it's trying to settle into its natural evening rhythm. And after years of listening to seniors describe their nights, I can tell you these patterns show up far more often than most people realize. Think about the hours between dinner and bedtime. For many older adults, this is the longest stretch of sitting they do all day. Maybe it's relaxing in the recliner, watching television, scrolling on the phone, or reading quietly in the same position for hours. On the surface, it feels peaceful. But inside the body, circulation slows dramatically when you sit still for too long. Blood pools in the legs. The muscles that help pump blood back toward the heart become inactive. As the hours pass, the heart begins to compensate for this sluggish circulation. You might notice swelling in the ankles or a heavy feeling in the legs. For some seniors, this leads to nighttime pressure or an uncomfortable pounding sensation when they finally lie down. It isn't the heart failing, it's the heart trying to push against stillness. Another behavioral trigger is emotional overstimulation in the evening. Many older adults watch intense news, dramatic shows, or stressful movies late at night without realizing the emotional impact. When your brain absorbs stress, even from a screen, your adrenal glands respond with adrenaline. Adrenaline tightens the blood vessels and signals the heart to beat faster. This is part of the fight-or-flight response, but it doesn't know the difference between real danger and a dramatic headline on TV. Over time, this creates a pattern where the heart becomes more alert and reactive during the evening hours, even when your body is physically at rest. I've had patients tell me they lie awake long after the TV is off, feeling wired, unsettled, or unable to slow their breathing. It's not their mind alone. It's their heart responding to the chemical ripple effect of emotional stress. But one of the most common and underestimated evening habits is overthinking as the day winds down. It's incredibly human. The house gets quiet, the distractions fade, and suddenly your mind has space to replay conversations, worries, regrets, or to-do lists. Worry raises nighttime cortisol, and cortisol nudges the heart to stay active instead of relaxing. When cortisol is high, breathing becomes shallower, oxygen levels drop slightly, and the heart compensates by working a little harder. Many seniors tell me they don't realize they've been holding their breath or tightening their chest muscles until the tension becomes noticeable. This inward stress, even when silent, sends a message to the heart that the body is not safe enough to rest. Hydration habits also play a surprising role. Many older adults avoid drinking water in the evening because they don't want to wake up to use the bathroom. It's understandable, but small dehydration thickens the blood just enough to increase the heart's workload. A heart that is already tired from a long day suddenly has to pump a slightly more concentrated volume of blood through vessels that may be stiffer with age. This can lead to nighttime headaches, restless sleep, or a racing heartbeat when lying down. I've seen remarkable improvements in patients who simply shifted their hydration earlier in the day while still allowing themselves a small amount of water in the evening. All these behaviors share one thing in common. They create conditions where the heart has to stay active when it should be settling into rest. Evening should be a time of gentle release, but modern routines often pull the body in the opposite direction. The good news is that once seniors understand how behaviors shape the heart's nighttime state, small changes can bring powerful relief. As we move into the next section on environmental and lifestyle factors, you'll see that the world around you also speaks to your heart, sometimes more loudly than you think. Environmental and lifestyle factors. As we move forward, I want you to think about something many people overlook. Your environment, the space you live in, the room you sleep in, and the subtle choices you make around comfort and routine all send messages to your heart. These messages can either soothe the cardiovascular system or quietly strain it. And in my experience, these external factors often explain why someone feels perfectly fine during the day, yet struggles with nighttime discomfort. Let's explore how the world around you shapes the world inside your chest. One of the most common environmental triggers is room temperature. Seniors are often more sensitive to variations in heat and cold because aging reduces the body's ability to regulate temperature efficiently. When you sleep in a room that's too cold, the blood vessels constrict to preserve heat. This narrowing of vessels forces the heart to push harder to move blood throughout the body. On the other hand, a room that's too warm increases the workload because the heart must help the body cool itself. Most cardiologists agree that the ideal sleep temperature for older adults is between 65 and 68 degrees Fahrenheit. Yet many seniors don't realize that drifting even a few degrees outside that range can affect nighttime heart rhythm. I've had patients who solved years of nighttime pressure simply by adjusting the thermostat before bed. Air quality is another factor that quietly shapes nighttime heart stress. When a bedroom has poor ventilation, dust buildup, mold spores, or stagnant air, oxygen levels drop slightly. It may not be enough to trigger coughing or obvious discomfort, but it is enough to force the heart to work harder to deliver adequate oxygen to the body. Seniors with conditions like mild asthma, allergies, or early-stage heart or lung disease are especially sensitive to this change. Many people sleep with windows closed year-round, unknowingly trapping air that's been recycled all day. Sometimes opening a window for 10 minutes before bed or using a small air purifier is enough to change the way the heart behaves at night. Another lifestyle factor that surprises many older adults is alcohol used as a sleep aid. A glass of wine or a small drink may create a sense of relaxation, but once alcohol enters the bloodstream, it disrupts sleep cycles and raises your heart rate. Alcohol also widens blood vessels initially, then triggers a compensatory tightening later in the night. This seesaw effect can make the heart feel jumpy or unsettled. One of my patients told me she couldn't understand why she woke up every night at 3 a.m. with her heart racing. When she stopped having her evening drink, those episodes disappeared within days. Alcohol is deceptive. It promises calm, but delivers instability. Medications are another piece of the puzzle. Some seniors take blood pressure pills, decongestants, or pain relievers later in the evening without realizing that the timing affects the heart. Certain medications increase heart rate, raise blood pressure, or interfere with sleep cycles. When taken too late, they can overlap with the body's natural attempts to wind down. The result is increased nighttime heart stress. This doesn't mean the medications are harmful, but their timing is incredibly important. A simple conversation with a doctor or pharmacist can make the difference between a restful night and a restless one. When I look at all these environmental and lifestyle elements together, one thing becomes clear. The spaces where we live and the choices we make before bedtime have a powerful influence on the heart's workload. Seniors often underestimate how such small external factors can have such meaningful internal effects. But the heart responds to everything: temperature, air quality, stimulants, chemicals, and even routines. As we move into the next section, we'll talk about the physical symptoms and underlying conditions that often worsen at night. Many of these conditions interact with the habits and environments we've just discussed, creating a perfect storm of nighttime stress. Understanding this connection is the first step toward reclaiming evening comfort and protecting your heart long-term. Physical health factors. Now that we've explored how your habits and environment influence your heart at night, let's turn inward and talk about the physical changes and conditions that often make evenings more challenging for older adults. These factors are deeply personal, and many seniors overlook them because they assume discomfort is simply part of aging. But in my experience, the body rarely creates symptoms without a reason. When something feels different at night, it's usually a message worth listening to. One of the clearest signals the body sends is nighttime swelling. Many seniors notice their ankles, feet, or even hands becoming puffier toward the end of the day. During the day, gravity pulls fluid downward, and if circulation is not as strong as it used to be, that fluid collects slowly. By evening, the heart must work harder to move it back through the system. When someone with moderate swelling lies down, the fluid shifts and can briefly overwhelm the heart's ability to adjust. This often shows up as pressure in the chest, a feeling of heaviness, or difficulty getting comfortable enough to fall asleep. Another sign that often appears at night is breathlessness when lying flat. This symptom can be subtle, like needing extra pillows or waking up suddenly to catch your breath. Many seniors dismiss it, believing it's simply stiffness or age. But it's actually one of the earliest signals that the heart or lungs may be struggling with fluid management or weakened function. When you lie flat, the fluid in your body redistributes, and if the heart isn't pumping efficiently, even a small shift can feel overwhelming. I've had patients who lived with this discomfort for years before they realized it wasn't normal at all. Nighttime anxiety is another overlooked issue. It may feel emotional on the surface, but the body often drives it. When oxygen dips slightly, when circulation slows, or when blood pressure fluctuates, the brain responds with a surge of alertness. This can be mistaken for anxiety when it's really a physiological reaction to imbalance. Seniors often tell me they feel fear or restlessness at night, without knowing why. But in many cases, the body is simply trying to protect itself by signaling that something isn't quite right. Irregular heartbeat sensations are also more common at night. During the day, movement and distraction make these small irregularities less noticeable. But when evening comes and the body becomes still, the heart's rhythm becomes easier to feel. Older adults often describe it as skipping beats, fluttering, or tapping against the chest wall. These sensations can be harmless in some cases, but they can also be early warnings of stress, dehydration, medication effects, or underlying heart rhythm changes. These physical symptoms often interact with certain health conditions that naturally worsen in the evening. Sleep apnea is a major one. When breathing pauses repeatedly during sleep, the heart must repeatedly jolt itself awake to compensate. This disrupts oxygen flow and puts tremendous strain on the cardiovascular system. GERD is another condition that becomes more aggressive at night. Acid reflux doesn't just affect the stomach. It can irritate the chest and raise the heart rate as the body attempts to protect the airways. High blood pressure, fluid retention, and poor circulation also intensify during the evening because the body's regulatory systems slow down. When combined with late meals, emotional stress, or a room that's too warm or too cold, these conditions create a perfect storm that pushes the heart to work harder during the hours when it should be recovering. The most important thing to remember is this: these symptoms are not simply aging. They are early warnings, gentle reminders from your body to pay attention. When seniors learn to recognize these signs and connect them with their daily habits, they reclaim a sense of control. And once they begin adjusting their routines, even small improvements can change the way their heart behaves at night. As we move into the final portion of this main content, we'll focus on practical solutions. These are gentle, heart-friendly adjustments you can weave into your evenings to support your cardiovascular system and create a calmer, more restorative nighttime routine. Your heart works tirelessly for you. These next steps will help you give something back. Practical solutions. Now that we've walked through the hidden stressors that affect the heart in the evening, let's shift towards something far more empowering: the changes you can make tonight that truly make a difference. Over the years, I've seen seniors transform their nights simply by adopting small, thoughtful habits that support the body when it needs it most. These solutions are not complicated. They don't require expensive tools or dramatic lifestyle changes. They're gentle, practical, and deeply effective because they work with the body's natural rhythms, not against them. Let's begin with eating patterns, because what you do at the dinner table shapes the entire night that follows. A heart-friendly evening doesn't mean giving up the foods you love. It means choosing foods that love you back. A lighter dinner allows your digestive system to work without pulling extra resources from your heart. Meals built around lean protein, soft-cooked vegetables, and low-sodium broths give your body fuel without overloading your circulation. Avoiding heavy desserts at night keeps glucose steady, which helps your heart stay calm instead of compensating for sudden spikes. Herbal teas like chamomile, ginger, or peppermint can help digestion settle, and they send a quiet message to your nervous system that the day is gently coming to an end. Movement also plays a huge role in how your heart handles the evening transition. I've witnessed remarkable improvements in patients who simply added 5 to 10 minutes of slow stretching before bed. Stretching opens the chest, loosens the back, and improves blood flow to the legs. Even a short walk around the living room or hallway after dinner can encourage circulation enough to prevent that heavy, swollen feeling many people experience later in the night. When movement becomes a small ritual, the heart feels supported rather than left to do all the work alone. Breathing exercises are another powerful tool. Slow, controlled breathing increases oxygen exchange and signals the heart to settle into a more peaceful rhythm. Something as simple as inhaling for 4 seconds, holding for 4 seconds, and exhaling for 4 seconds can lower nighttime heart stress within minutes. Equally important is the way you unwind emotionally. The heart responds to how you feel long before it responds to how you behave. If the mind is restless, the heart stays active. Gratitude journaling is a practice many seniors find surprisingly calming. Writing down even 3 simple things you're grateful for shifts the nervous system from tension to appreciation, which relaxes both the mind and the cardiovascular system. Soft music, gentle reading, and dim lighting also work together to create an environment where the heart feels safe enough to slow down. If your days are filled with stress or news updates, letting the last hour of the evening belong to peace can make all the difference. Then there's the sleeping environment itself, which often needs only small adjustments. Good air circulation keeps oxygen levels stable. So, opening a window briefly or using a quiet purifier can give the heart the support it needs through the night. Keeping the room at a comfortable, cool temperature helps your body regulate itself without forcing your heart into overdrive. Soft, warm lighting signals the brain to produce melatonin, which naturally lowers blood pressure and prepares the cardiovascular system for rest. Avoiding emotional triggers or stimulating content during the final hour before bed gives your heart space to relax instead of react. Your sleep routine is the final piece of the puzzle. Going to bed at the same time each night stabilizes your internal clock, and the heart thrives on consistency. Multitasking late at night, staring at bright screens, or going to bed in an activated emotional state sends mixed signals to the body. If you're prone to reflux, elevating your head slightly prevents nighttime pressure and makes breathing more comfortable. And while it's important to avoid excessive water intake late in the evening, Staying moderately hydrated throughout the day prevents the thickened nighttime blood that makes the heart work harder. All these practices add up. They create an evening environment where your heart doesn't have to fight, monitor, or push as hard as it often does. They help the cardiovascular system release tension, recover from the stress of the day, and prepare for the healing work that happens during sleep. And the best part is that you don't need to adopt all of them at once. Even 1 or 2 changes can shift the way your heart feels within a few nights. Your heart has carried you through every day of your life. These small steps give it a softer landing each evening, and they remind your body that rest is allowed, safety is present, and healing is possible. In the conclusion of this video, we'll bring everything together and reflect on the deeper message behind these habits. That awareness and consistency can transform not only your nights, but your long-term heart health. As we come to the close of this journey together, I want to leave you with something gentle, yet powerful. The evening habits we talked about are not failures, and they are not signs that you're doing something wrong. They are signals, quiet reminders from a heart that has carried you through every season of your life. The heart is remarkably resilient. It responds beautifully to even the smallest acts of care, and it never stops trying to protect you, even when you're unaware of the work it's doing. Take a moment to feel gratitude for this organ that has been beating faithfully since before you were born. It has never taken a single day off. Every joy, every hardship, every milestone, your heart has been right there with you. When we begin to appreciate its strength, it becomes easier to offer it the compassion it deserves. Gentle evening routines are not just good habits, they are a way of saying thank you to a body that has carried you far. Remember that change doesn't come from grand gestures. It comes from consistency. One small shift each evening, whether it's a lighter dinner, a calming breath, or a moment of stillness, can reduce inflammation, improve circulation, and bring your heart rhythm back into balance. These small steps build a foundation of healing that grows stronger with time. And here's the hopeful truth. Even at 60, 70, 80, or beyond, the body still adapts. The heart still learns. Healing doesn't stop with age. It begins the moment you become aware and choose to care for yourself in simple, intentional ways. You have far more influence over your nighttime health than you may realize. Your evenings shape your heart's tomorrow. When you honor them with kindness and patience, you create a path to deeper rest, clearer energy, and a stronger life ahead. If you found this message meaningful, I invite you to stay connected with Senior Health Daily so we can continue walking this journey together. Your heart deserves the very best, and I'm here to help you protect it every step of the way.